Intermountain Healthcare is a very, very well-run medical care network in Utah. I've actually worked with Intermountain Healthcare in multiple generations of my career. Met a lot of people there, and the folks that I talked with there have really taken this seriously. In the healthcare industry, of course, a lot of the jobs are mission critical, a lot of the jobs are technical, and a lot of them are operational. And there is a lot of hiring and retraining and job mobility in healthcare. I talked about that a little bit earlier. And so what Intermountain did, Intermountain happens to be a company that is very deeply committed to the learning and development part of the business and the continuous skilling and operational management of human capital. And what the company did is the head of L&D came together, I guess it was over 10 years ago, and said, let's standardize the operational skills we need. And they came up with 5,000 clinical competencies. I don't know if those are common across every healthcare provider or not, but I don't think they are. And they made sure they had these clinical competencies by role and specialty and job. And what the person who talked with me about this said, Mark Lemon, was it was a mess. And it was a long process to get everybody to agree what these operational skills were. Of course, job titles and job levels keep changing in companies, so it required a certain amount of rigor to match them to different job levels. However, by sticking with it, and I'm sure there was a senior executive team that was committed to this, they standardized on it. They standardized on the verification and validation of these skills, and they now have a system that is allowing them to look across all of the hospitals and determine who is qualified for what role, and quickly determine if somebody is ready for another position or a rotation or a job move, or if they need to be recertified and reskilled. And Mark told me it has been a miraculous, really improvement in their operations. And I don't know how many people they're hiring every year, but if they're having 40% turnover like everybody else in healthcare, this is a business critical system. So if you're in the healthcare industry, the kinds of things that Kahuna does are absolutely essential.